Bipolar disorder. By the end of this video, you should be able to define what bipolar disorder is, describe the different methods of its diagnoses, summarize some of its statistics, list the different classifications of medications used to treat it, explain some of the goals of psychotherapy treatment for bipolar disorder. Bipolar disorder is a mental illness that is characterized by shifts in mood, energy, activity levels, and the ability to carry out daily tasks. The two poles of bipolar disorder are mania and depression, and the two types of bipolar are bipolar 1 and bipolar 2. Bipolar 1 is characterized by periods of severe mania followed by severe depression episodes. And bipolar 2 is characterized by hypomania followed by episodes of severe depression. The symptoms of a manic episode are excessive happiness, increased activity, excitement, less need for sleep, and a high sex drive. The 5th edition of the Diagnostic Statistical Manual classifies a manic episode using the guidelines listed. The key here is that the impairment from manic symptoms makes hospitalization necessary, especially if psychotic features are present. This is a creative depiction of the two poles of bipolar disorder, mania on the right and depression on the left. The symptoms of a depressive episode are sadness, anxiety, loss of energy, uncontrollable crying, increased need for sleep, and thoughts of death or suicide. The DSM-5 classifies a depressive episode as the presence of five of the below symptoms in a 2-week period, with at least one of them being either depressed mood or apathy. When being diagnosed, bipolar 1 can be classified as either mild, moderate, or severe. Other symptoms that may be present include psychotic symptoms, anxiety, or a rapid cycling between mania and depression. To be diagnosed with bipolar 1, an individual must have had at least one lifetime manic episode. Also, this manic episode and a major depressive episode can't be attributed to another disorder such as schizophrenia. Patients with bipolar 1 typically do not seek treatment when they're in the midst of a manic episode. Heightened senses, antisocial behavior, or delusions may also occur during a manic episode.
Bipolar 2 can be characterized in the same way as bipolar 1. The key concept to remember is that it is not a milder form of bipolar 1. In fact, patients with bipolar 2 tend to stay in depressive states longer, and the disorder is typically more chronic. Criteria for bipolar 2 includes at least one hypomanic episode, at least one major depressive episode, patient has never had a manic episode before, condition is not attributed to another disorder, causes clinically significant distress or impairment. It is usually the major depressive episode that causes an individual with bipolar 2 to get help, since this is the main source of distress. The unpredictable mood fluctuations rather than the hypomanic episodes themselves are what causes this distress. Hypomanic episodes, according to the DSM-5, are characterized by a period of elation or irritable mood and abnormally increased activity lasting at least 4 consecutive days. During this period, 3 of the following symptoms are present. Although bipolar disorder can occur at any point in life, the average age of onset is 25. Every year, 2.9% of the U.S. population is diagnosed with bipolar disorder, with nearly 83% of these cases being classified as severe. Bipolar disorder affects approximately 5.7 million adult Americans. An equal number of men and women develop bipolar disorder, and it is found in all ages, races, ethnic groups, and social classes. Bipolar disorder results in 9.2 years reduction in expected lifespan, and as many as 1 in 5 patients with bipolar disorder commit suicide. In all, about 80 to 90% of people diagnosed with bipolar disorder have a family history of either bipolar or major depression. You can see on this chart how low your risk of being diagnosed is if you do not have a relative with the disorder. Treatments for bipolar disorder include medication, psychotherapy, and other adjunct treatments. Generally, treatment consists of a mix between both medication and psychotherapy. Some medication types include mood stabilizers, such as lithium or valproic acid, antidepressants used for depressive symptoms, and atypical antipsychotics, which are new medications to treat a broad range of symptoms. Psychotherapy treatments consist of cognitive-based therapy, family-focused therapy, and interpersonal and social rhythm therapy. These really just focus on dealing with and handling symptoms of bipolar disorder, as well as the adherence of medications. As mentioned earlier, bipolar disorder affects many people from all walks of life. Therefore, it is important to understand what it is, what its symptoms can produce, and what treatment entails for the individual with bipolar disorder.